Hello, everybody. This is Rajendra. I'd like to go over my test that I got from the doctor. Having complaints of brain fog and low energy. Okay, so we're going to take a look at the. Uh, okay, so this is the blood test that I ordered, and this is not the doctor. So my cholesterol, it says high. This was done more than 6 months ago. So I don't think it's valid. It needs to be less than 6 months. But you can see the triglycerides levels are pretty competitive in green, just below the marker. The cholesterols are slightly higher, not too high. LDL are slightly higher, and the ratio is also borderline. So nothing much to worry about as far as cholesterol goes because there's a lot of room. Um, Here, this one is a calculated one. The HDL is borderline high in the green, so that's good. Glucose is 120, which is so glucose could be the main culprit here, because the associated brain fog, and it's known as type 3 diabetes. So that could be an issue. But what's going on with cholesterol. So all the other things in the blood look normal. Hemoglobin, MVC, RWPB, they all look normal. Tropopine, yeah, that's something if a person is having clogged arteries in the brain. It's not a stationary marker. It's a very dynamic marker. It keeps changing, but and we hope to catch it if it's very consistent. In this case, we either caught it when it was low or all right. So the arteries of the brain are clean, okay, and it is considered valid because it's less than 6 months. Right now it's September. Uh, uh, 12th. So that is within the 6 month range. So it's okay. Okay, CRP optimal is less than 1. Okay, so this is less than 1, so it's good. And this is also a dynamic marker, so it keeps changing. Okay, the methylmalonic acid is also within the range. The lactic acid seems to be on a borderline high. Okay, so this is also a very, very dynamic marker, keeps changing every day. So if this is the lowest point it can reach, then lactic acid is a concern. This is also reasonably within normal range. Okay, now let's take a look at the urine test. Urine test, all of the markers look pretty much in the range. Let's see if there's any borderline high. Nope, there's nothing that's borderline that I would say is significant. Okay, so, but see, this was done on a different day. So it looks like when the urine analysis was done, the EKG was also taken. Okay, so let's take a look at the EKGs. Okay, this is a 1 minute EKG done after lunch. So after lunch, the patient does complain the heart rate goes up, and see that's 99, borderline tachycardia. After lunch, the person also has PVCs, okay, which are fixed with the sharp modulation in RR interval. So a body is able to fix those PVCs. There's hyperpolarization in ST segmentation that may show vascular dysfunction. Okay, so you can see that there's only one PVC on page 9. It says right here. Yeah, there are two PVCs on page 9. Okay. And okay, so that is being fixed by heart rate variability, and you see the heart rate variability is pretty steady. When it reaches very steady like this, and it's flat, that means it's probably performing to its max. Okay, you see there's a hyperpolarization in ST segment here, in here, slightly over here, but not that much. Okay. This is a standing EKG, and you can see the EKG appears to be pretty clean, but there is one a PVC. No, there are couple of PVCs. The number of PVCs have not changed from sitting to standing position. Okay, so here is one PVC. Okay, and we see it in all the lids, and it's again fixed by modulation of RR interval. Although the RR interval modulation appears much earlier, and so let's see, there should be another one here somewhere. Okay, there it is. Okay, so this one where the AVL seems to be functioning okay, but AVR and AVF seems to have a PVC. Lead 3, lead 2 is detecting it. Lead 1 not so much. And there is actually no blip in AVL. So there it is. The AVL has no blip at all. And to compensate for that, the AVR is doing the AVR is doing a PVC, AVF is doing a PVC, and lead 3 is doing it, lead 2 is doing it. Okay. Okay, if we compare the sitting versus standing, the standing, we do see some improvement in hyperpolarization there. It's been reduced. Here in the Q point and the ST segment, and here as well. Thank you.